We've talked, and then, if surgery is the, growth of surgery is our goal, then, we've got to look at expanding our numbers of surgeons. And I talked with Dr. Patino, and Dr. Patino, I don't know if you know, Dr. Patino works for us about half-time. And by the way, he's compensated at about half-time. And he and I talked about, about what it would take to grow our surgery volume. He's here, Dr. Irk from Stephenville comes over on a part-time basis, a day a week or so. He does lots of scopes, not a lot of other stuff, but does lots of scopes. But as Dr. Patino and I were talking about, the recruitment of a surgeon is difficult because it's very difficult to recruit one surgeon. If you're going to try to grow your surgery so that you've got a surgeon on call, so that you could ultimately have an OR crew that's on call, you really want to have to recruit 2 general surgeons to do that. And that's, then the question is, do we have enough surgery for 2 surgeons? Certainly based on the history for the last several years, the answer to that right now would be no.
I interject here.
Absolutely.
First of all, I don't think I'm hired as a part-time. I bought a house here, I live here, and I answer questions from the ER, from the doctors and staff at night, on weekends. If I have to come my grounds on weekends, I do it. I don't mind coming and doing any case at any time. The problem is, like you said, we need the infrastructure to be able to provide more services to the community. There are many cases that are run by me from the emergency department that cannot be done here safely. And the last thing I'm going to do is compromise my patient's life. Because I don't want to increase my volume at the cost of patients safely. So that's never going to happen on my shift.
Yeah.
And it's true. If you want to provide, quotation mark, full-time surgical services, you look at what you have in your operating room, look at your equipment, look at your personnel. Then you're probably going to have to look at least for 2 surgeons, because there's nobody that can come here and work day in and day out, 7 days a week, 365.
Great.
It's not going to happen. I don't care how much money you offer people, they're not going to work. The surgeons that are graduating today don't want to be working more than 1 weekend every 6 and more than 1 or 2 days a week, if at all. That's why they all go to the cities, because the hospitals have hospitalist surgeons that take care of all of the emergencies. They don't have to take over. And so therefore, the problem with surgical manpower is a very serious one. And any one of you can go to the ACS, American College of Surgeons webpage, and you find information about surgeons' shortage, how it's projected to become worse in the next 10 or 15 years. So little hospitals, little institutions really are going to be struggling to get surgeons. And in fact, there are several programs. One of them was started about 15 years ago in Florida, where the big trauma center for the University of Florida signed up with a bunch of hospitals around them, where the little hospital run a surgery service during the day, let's say 7 to 3 or whatever, Monday to Friday, and anything after 3 goes straight to the trauma center, the big place, because they have crews in there that they have to pay for. But it costs a lot of money for a little hospital to have a crew on call when they're not going to use it, but maybe once a month. So from the point of view of cost, it's not cost effective to look at it that way because of the changing in the medical field. Now, we have now other things like the ACOs. What's going to happen with all these accountable care organizations?
Mm-hmm.
What's going to happen with all these government mandates now, where everything's going to be capitated and your ACO is gonna get a certain amount of money to take care of this patient, and that amount of money includes general practitioner, internist, cardiologist, surgeon, radiologist, anesthesiologist. Everybody has to get a piece of the pie, and the hospital gets a piece of the pie. So everything is gonna get still tighter. So you're looking at really studying this and getting knowledgeable about where things are going. It's not that easy. And from my end, I think that to increase the volume of surgeons, we need to do a lot of things in the operating room. And also, the base of family doctors, general practitioners needs to be increased. And obviously, the commitment to keep the patient here and follow them together with the surgeon is very important. Again, the problem is when you have limitation in nursing, in rooms that could have a monitor, like an ICU bed, it really, really holds you back in a lot of things. From my point of view, you can have a surgery. If I haven't done it, it doesn't exist. I've done surgeries of all kinds in little places, including vascular, thoracic, and all that. The problem is, that was back then, and I had everything I needed. I could put a swan lens, I put an R-line, I had the nursing to do it, I had the intensive care 2 unit, I had the respiratory therapy on call to handle ventilators, and we did all that. But you can't do it, and you can't offer anybody less than what you're going to get elsewhere. And until that's met, you're going to have the same problem. Anybody you come and bring here, you can promise him the moon. It's going to fail unless you have all that in